We do not always appreciate the importance of our health until we lose it. When we are told that nothing can be done to heal us, no matter how much money we have, everything that seems so important before now starts to lose its value. We experience pain, desperation, and loneliness in the presence of others. Then we acknowledge that healing is a gift that goes beyond medicine, that there are other options out there that may help us, and that there is a higher power that controls the distribution of this gift. As a result, we hesitantly and somewhat reluctantly begin to explore these other avenues. To our great surprise, we discover the secrets of the universe through alternative medicine. We experience and respect the generosity of divinity through various health modalities. Our faith is restored, our health improves, and life begins to make sense again. Health is a basic human right. And healing is a gift that is given to us by God through a variety of channels, including doctors and other alternative practitioners. How is it that until now we did not know that there was so much on offer? That doesn't really matter, for now we are being given the chance to know.
A warm welcome again to episode 11 of our show. I have seen and treated a lot of people with symptoms that look similar, but which are caused by different sources. I want you to take a look at these images just to illustrate my point. At a glance, these look similar, and you can easily think that all these people suffer from a severe form of arthritis. Very wrong. Very wrong indeed. Let us take them one by one. One suffers from scleroderma, an autoimmune disorder which damages connective tissue. The other suffers from spinal cord herniation, a growth in the spine which causes compression. The third one is multiple sclerosis, which damages the protective cover of the nerve cells of the spine and central nervous system. Yes, rheumatoid arthritis does cause this type of deformity as well. But my point is that you can never base your diagnosis on what you see or on what the person is experiencing. Until health practitioners, particularly conventional medicine, start to acknowledge this fact, problems as we see them today in the medical and health field will always persist. Today we are presenting our third winner, Lulama Tambo. He is a 42 years old who was diagnosed as having a stroke. He never responded to some programs that are usually offered to people with stroke, but instead he started having epileptic fits, which were never controlled by medication, but instead keep getting more frequent in spite of the increase in medication. He even had 2 bouts of fits on the day we were filming this show. This case will illustrate what I spoke about earlier, that is, you can't base diagnosis on symptoms because they may mislead you. They should only serve as your point of departure to get to the cause. Please take a look and enjoy the show.
Welcome. We are here in Zwede to interview Mr. Tambo, our July winner. Hello, Mr. Tambo.
Hello.
Thank you so much for inviting us into your home for this interview. Thank you. Mr. Tambo, why did you enter this competition? What do you think is wrong? Why do you think you like? When did you have the stroke? What did the doctors say? What did they say is wrong with you? So, did they not put you on a treatment program for the stroke? And how did you cope around the house with the condition that you have? Thank you.
Okay. Oh, kwakunge 22 ska February last year. Ululama wayesenza ipapa. I remember that time wayesenza ipapa apha kitchen. Wathi udize. Xa nimbuza ba into wathi akayazi intwanayo. Ndazomhlasa apha ekhawushini. Xa nimjonga ndafumanisa ba umlomo wakhe ujikekile ukule ndawo. Ngamzama bandibuzwa kwenzeka ntoni ndabe andazi into ngestroke. Ndabiza kumelwane wazomjonga wathi mandifonele iambulance. Ndafonela iambulance, yes ambulance. Bazomjonga abantu beambulance. Bafumanise ke nobana unestroke. Kwabuzwa kwenzeke ntoni ndathi andiyazi. Ba ke bengena nix bamthatha ke bamsa straight eDorangisa. Phaya eDorangisa ke ufike esekukoma ke engathethi engicimele for about 2 weeks or 3 weeks engathethi. Sekusenjalo ke simane sindisiya ke Dora manje siye Dora wabe right ethetha ke nam kodwa estrugglisha abekuthetheni voice yakhe uphuma. Xa fasa ke besenziwa yonke into ke chanyiswa eDora kodwa ke uhlele into engangenyanga ezimbini for 2 months eDorangisa wa discharge ufumasa bana akakwazi uhamba uyastrugglisha apha ekuhambeni wathunyelwa apha endlini. Esathunyelwa apha endlini njalo kwafumanise ke ugqirha wanixelela ke ba i-cause ba makabe ne-stroke ba wafumasa ka HIV positive. Uthuka ke ba zange siyazi sicingele ke loo nto. Kwathiwa ke uzawuqala uhamba i-treatment i-wellness i-treatment i-physiotherapy. Uqalisile ke kwi-treatment yakhe yokuqala eDora. Wellness ke kwi-physiotherapy ndiye ngokwam ndomenzela makangene inantsika aqale i-physio. Banika ke bandibhukishela ke lo nyanga wayihamba ke both i-wellness nenantsika i-physiotherapy. Pha i-physiotherapy ke bamkhuphile uhambe inyanga inoba more than 6 months bathi akakhophi at least kudala ngoku bamdischarge wahamba only ke ngoku wellness so utya ke kwi-treatment i-HIV. So kulo nyaka this year I think apha February March if I'm not mistaken wafumanisa wafitisha ke ndambizela i-ambulance wayeswedora phaya ke kutya i-treatment yofita yona iqhozula. Uthe kusenjalo still usacontinuisha ke wafumana seba une-TB wahamba ke program ye-TB wayigqiba ke but ushekele only le nyanga kaFebruary azogqiba i-treatment yakhe ye-TB i-results zakhe zokugqibela uyayigqiba ngoJuly. So usahamba ke only i-wellness kuphela. Ngokwalapha endlini ke ubefike embi erongo bengakwazi uhamba esebhedini ebetrainiswa ndim ndimthathe ndimse etoilet ndimbuyise ndimtrainise benimvisualizer ngokwam ngefoni eseku-wheelchair ndamzama ndimtraina kodwa i-physiotherapy yona imfumene eredi ekwazi uzihambela. So bamnika yonke induku uba makasimelele ngayo makasime kwabe apha endlini besebenzisa umtshayeli wasuka ke ku-wheelchair ndathi suka nakule wheelchair uzama uzihambela wazihambela. Ndamtrainisa uba makazivase ubuso azivase ikhwapha but when it comes suppose uvasa umzimba wonke iba ndim umuntu omvasayo because baloku usebenzisa isandla sase-left so ndimvase wonke but apha body ke uyazenza ngokwakhe azivase ubuso azixukuxele uyakhopha apha endlini uyakwazi ke noma esinkini avase izitya ngesandla esi-1 and ebesoloko ekwi-closet engafuni udibana nabantu. Ndiyatry uthetha naye uba phuma uye ebantwini uzoqhelana nabantu yabo suba nentloni waphuma ke uyakwazi uhamba ye next door ahamba ye kwindlu engaphaya phinda abuya zapha endlini at least ngoku uyadibana nabantu uyakwazi ukhopha babe kunzima before. Qha iproblem yakhe ke ngoku akasekho ngolaa hlobo belulo apha ekuthetheni uyastruglisha even ingqondo yakhe ayisekho ngolaa hlobo ayifunction ingathi ngumntana una 2 years 3 years yabo kodwa ke ugqirha wayemsile kwi-brain scan but abazange bandichazela uba kwenzeke ntoni. Ndiyafuna uyazi nangokuba kwenzeka ntoni ngokwasengqondweni yakhe kodwa ke uyaremember kwinto ebiyenzeke ngoko but ibe khona laa nto iphinde imphazamise.
And around the house now, how is he coping here at home now at the moment?
Uyakhopha but sometimes ifike laa nto uba abe worried uba kube lolu hlobo alulo otherwise right.
I'm sure it must have been a big impact on this family when obviously it happened. What are your wishes?
Oh, ii-wishes zam mntana kamamam ndinqwela umbona uba aphakame abe right abe normal ngolaa hlobo besimazi ngalo azenzele into zakhe azivase kuba kaloku xa kufikela xesha loba mandimvasa kubi lula kuye kuba uba tense because kaloku ungubhuti yabo xa ndimvasa wonke akukho lula but ii-wishes zam ndimwisha uba makaphile abe right abe normal.
Thank you so much for having this interview with us.
Thank you.
Ngiswayiswaye ke le.
Phela kalulama.
Vile elikaswayiswaye zawusebenza lona lapha. Kunjani swayiswaye? Akulifuna elikaswayiswaye ne? Akulifuna? Ligama lakho
Ngazibanga
ligama lakho. Nickname yakho unjani ke futhi?
Unqonde baba.
Yabona njani seseqa.
Alright sis.
Alright. Okay. Umnqondo wakho ufuna uthini ke lona?
Ndifuna ukwazi uzenza yonke into zami kakuhle.
Alright.
Kalahle bonke.
Ubulilo
Naqala,
Alright ke but ndiyabuva.
Bamba
Apho ke lo mnqweno. Ungawulahli. Ubambe kuwo lo mnqweno. Ungawulahli because siya kuwo sisebenzela kuwo. Uyaqonda? Sisebenzela kuwo. Ndiyavuya kuba idifike le mini yoba so ndiyavuya bethunana. Ndiyavuya swayiswaye, ndiyavuya noMasinga kuba side sifumana le mini yokhe sizoqalisa ukusebenza ngoswayiswaye. Ngeke baye sitsho I'm sure ngumnqono wakhe yedwa lo umncane wakho nawe. Okay, ndiyenzile ke i-analysis yakaswayiswaye. Okokuqala into endiyifumanayo kuye unesigulo ekuthiwa yi-multiple sclerosis. Now i-multiple sclerosis sisigulo esenzeka because i-immune system i-attacka i-nerve, i-protective cover. Yabona i-spinal cord nengqondo ne-brain ziyasebenzelana. And zine protective cover. I-cover into enofanisa mhlawumbe ndithi xa ujonga intambo zombane ufumanisa uba kukho that insulating into ecoverisha intambo zombane. So ne-nerve cells ke zentloko kunye ne-spinal cord zine-insulating cover ezikhuselayo. Now xa une-multiple sclerosis ke xa i-immune system damage that protective cover. That's the problem. And it again because the brain is sebenza ikhabarisha ine functions ezininzi ezichaphazela umzimba. Ufumanisa zininzi indawo ezichaphazelekayo ongenazicingela ukuba zinento okwenza nalento. Even ne-spinal cord ufumanisa uba zininzi izinto ezichaphazelayo because alokhumbula ukukwazi i-limbs ezokusebenza kwazo kuphaya ku-spinal cord. Even ne-bladder like uba ndidla ngokutsho abantu abaninzi uba esinye ukusebenza kwesinye once ispine sichaphazeleka uzofumanisa uba kuzawuchaphazeleka na ukusebenza kwe-bowel once ispinal cord sichaphazeleka sizawuchaphazeleka. So kuxhomekeka uba umntu ngamnye ku-affecteka hlobo lwenani. Now ke nansi into yokuqala evelayo kuyo. Even naloo nto for instance njengoba unika ireport yakhe earlier on i-case ye-stroke inoba mhlawumbe nani ezibuza uba si-stroke esivelayo. Uyaqonda uba lo mntu mncinci zange kuthiwa unantoni the next thing si-stroke esivelayo. Of course i-stroke ayithethi uba senzeke emntwini ophilileyo, but ke in his case into eyenza uba end up affected ngolo hlobo such that sometimes i-stroke sithi mimic, i-multiple sclerosis ithi mimic. Xa imimikayo ke ngusinga uthi ucinga uba yilaa nto kanti i-multiple sclerosis. And ke for instance njengoba uchaza into obuqalisa ukuxhuzula kulo nyaka into entsha kwenzeka loo nto ku-multiple sclerosis because aloku you must understand uba njengoba kubethwa that protective cover akuhlali kubethwa leya part iya inwebeka ufumanisa uba bekukho i-problem engaka iya isa-extender ikhula ngokukhula because bekubethwe esa space but siyasinwebeka sinwebeka. So that's why you find he's starting to have seizures. Kodwa that's not the only reason eyenza uba abe ne-seizures. Akuxela uba yinto nenye that I've picked. In fact there are two things in this pickup highway that are also affecting him. But that is the first thing eyenza ukuba abe ukule condition. And as one sitsho, multiple sclerosis, it affects umuntu stiff neze. Ingeso stroke. Yako? Ufumanisa umuntu kuba stiff. And it's even worse in his part. Njengoba usithi ufeli cala, that side nyani kwi scan sakhe is actually showing not because of his stroke, but because of his multiple sclerosis. Yeah. So that is the first thing evelayo kuye. Now the second thing evelayo kuye kuvela kukhona condition ekuthiwa PNET, pancreatic neuroendocrine tumors. Now the problem kuye is affecting injeke yakhe kabini, twice. Imenza li condition ekuthiwa iglucagonoma. Now iglucagonoma, it's a condition. For instance, pancreas it produces insulin. Xa iswekile usityiza ukutya, masithi kusitya ukutya kufuneka end up convert kwenza glucose yaqonda iswekile. Now la swekile kufuneka ingenisiwe apha kwi cells apha emzimbeni, but ingeniswa usputsi wokungenisa ila insulin. So your pancreas produces insulin for control iswekile ingene apha ezindaweni zayo ingabikho too much egazini, because then it's dangerous. But kukho enye uhlobo lwe hormone oluproducewayo. In fact, two more hormones eziproducewayo phakathi in pancreas. Enye it's glucagon, you know. Now i-glucagon yona njengoba i-insulin izithoba i-sugar levels yona iyazinyusa. Zithi xa zihlile zinyuswe yiyo, so yiyo ebalansisa i-glucose levels apha emzimbeni apha egazini lomuntu uyabo. But ke kuye, he is actually diabetic, but not just diabetic, he is glucagonomic, which means i-sugar levels zakhe ziraiswa by i-glucagon, so they end up as menzela i-problem yeswekile, because insulin ngoku ayicope, because khumbula ukuthi for the sugar levels uba zibe in control kufuneka kubekho balance between insulin and glucagon. So if glucagon is on the rise, insulin end up ingakwazi ukuthi cope with maintain as a sugar level. So that is what is happening to him. So he is diabetic again, and the sugar levels are I'm curious because even though I know about checkish,
high blood
no, yeah, I would love, it would be interesting for me if we know each other, because the sugar levels are high, but pick up, you know, because of that glucagon, you know. So he is diabetic, but not just diabetic, but he's glucagonomic. But the second thing, glucagonomic, you'll find about any symptoms uyathanda nje uba confused, ufumanise ubuntwanish, uyaqonda, yeah, ungazibuza uthi let alone kune multiple sclerosis, but i-glucagon iyodwa even if bengena MS, but kule case yoba glucagonomic ufumanise uba and futhi une-rush, akana skin apha kwi-lower nantsika apha kwi-lower extremities, fine rush, exactly, glucagon layer. So the symptoms is high, because that's what I've picked up about. He's got, you know, because of the glucagon, so the childish confusion, and never find rush, that is a glucagon. So he's glucagonomic. The second thing, une gastrinoma. Now, a gastrinoma, now you got a problem with pancreas, but it produces gastrin, a hormone produces over pancreas, but the second is a siswi for sila. So and get it produces over my siluguja, not by my supply a gastrin because it end up raise acid levels. So for us, that is a mental cheese. So for us, that's the problem. So that's the other thing that is showing from the pancreas. He's actually he's got a gastronomic. Now the other thing that is I'm picking up with case here is Apha kwi-thyroid, I mean apha emqaleni kukhona i-condition ekuthiwa i-Hashimoto. There are many things. I-thyroid ke lidlala eli-producer i-hormone yokumetabolize, metabolism, not only for metabolize ukutya, even the cells, whatever needs to be metabolized, i-produced, I mean metabolized by i-thyroxine, i-hormones eziproduced by the thyroid gland. Now kwi-case yakhe, immune system yakhe, that's the second thing, upper immune system yakhe better called. Second thing where it's hitting him, it's attacking the thyroid yakhe, and the thyroid yakhe is overproducing. So he's got what we call a hyperthyroidism. So it causes him so such that because we are overactive thyroid, it's overactive because of Hashimoto. So he's got hyperthyroidism. Akube nehlaba, akube nehlaba. No, the fact that ugqibele kudala does not mean isolve a problem, because isekhona yaqonda. Une pha unento ekuthiwa yi-arterial cirrhosis. Arterial cirrhosis, there is plaque, accumulation of iron kwi-arteries zakhe is actually forming a plaque. So that's what is causing him even if aliko okwangoku, but it's gonna come back again. But because it's actually, he's got quite a bit of accumulation of iron, and it's forming it's actually hardening probably arteries, and enye izinto of must end up as a sensor umuntu uba makabe ne heart attack. Ngumuntu wesithathu nje manibona kule kwishow yethu, but all of them, omunye unesigulo sakhe sohlukileyo, omunye unesakhe sohlukileyo, naye unesakhe sohlukileyo, but all of them, it's common into yoba bobathathu, they are actually iron overloaded. All three of them were iron overloaded. But again, eyakhe case is a bit interesting Jan. But again, case the interesting thing that I've picked up in him, which made me take longer, because of a glucagon, because he is glucagonomic, he's got something that is called glucagonomic anemia. Now, anemia, as we understand it, it means umuntu is deficient with iron. But in this case, glucagonomic anemia does not mean that. It means if blood cells zakhe ezibomvu, there is a short supply of those blood cells. It does not mean the actual iron that is already absorbed is short. He's actually iron overloaded. But when it comes to his blood cells that are producing igazi, you know, there is a short supply. So he's got a different type of so it's very interesting case here in that he's got hemochromatosis, that is iron overload, but on the other hand he's got glucagonomic anemia because if blood cells is like as a producer, there's a short supply of energy because of the glucagon, you know. So there is that, so we need to balance to make sure the iron overload on one side we're sorting out, but the anemia is not the normal anemia, it's just the terminology. So he's got that as well. So which we need to deal with. Nazo into zakho ke swai. Alright, no fine. No treatment yethu ayikhabani wena ne treatment ezithile, but ke zikhona esesithi xa I mean, it's important for us to know, but that's okay.
Health Haven is a clinic that is in its own league. They stand out in their ability to detect illnesses which have defied the best practitioners in the field of health. They also offer treatment programs that yield phenomenal results. Because of the confidence they have in their healing gift and abilities, they have decided to do the unthinkable. They randomly select one ill person once a month from the entries of their competition and diagnose and treat the winner free of charge to the value of 20,000 Rand. Note that the person selected is unknown to them. They do not know his or her condition. They only get to see the winners for the first time when they go to film them. If you think Mr Stofile is a serious case that is impossible to treat, wait until you see the second and third winners. What gives Health Haven such guts? How do you restore the health of people like these, where doctors have thrown in the towel, unless you know your story?
Multiple sclerosis is a nasty autoimmune disorder. Not that there are better ones. What makes it worse is that it attacks the central nervous system and the spinal cord, and these are vital organs. It presents with various symptoms, and in most cases you may never link some symptoms to it at all. Like, for instance, lower back pain, which you may confuse with isinga, or people with multiple sclerosis, some have got a problem of not sweating. They may exercise or go to the gym and do a lot of exercising, but you'll find they will never sweat. Or one may have unexplained stress or anxiety. Some may have dizziness, others may have shortness of breath, others may even have epileptic seizures, like is the case with Lulama. The list goes on and is quite long. Multiple sclerosis even mimics stroke-like symptoms, as is the case with Lulama. But if you listen to his sister,
so ndamsa ke esibhedlele wazothathwa ngeambulance bamfake just idrip phaya bamnika itreatment. La treatment ke kutya ipills eyi-1 qhubekekile nayo, but still usakhulunyiswa ngoqhozula. Uyaphinda ke bamtshintsha ngelithi ke bamnika makatye kabini kunalalo besitya bekanye ngemini, ngokutya kusasa atye nangokurho, kodwa nalapho still usathi continue ngoqhozula. Nikaboni ihluko enza banixelele ke nekhozo balangabana ubangelwa into babakaqhozule.
you will actually notice that he was non-responsive to the program, and that is because he has a different condition, not the stroke. To fix him, therefore, we have to restore the insulating cover of the nerve cells of the spinal cord and the brain. Regarding epilepsy, one may argue that he is suffering from post-stroke epilepsy. Yes, some people who suffer from stroke do have seizures that are post-stroke, but you'll find that they do respond to the treatment. In his case, he is getting more and more seizures and more frequently, even though the treatment has been increased. This is because the insulating cover that is damaged because of multiple sclerosis keeps getting bigger and bigger because there is nothing that is done to repair it. Once we start fixing the cover, he will never have fits again. Also, his glucagonema, which I also mentioned, which is a pancreatic problem, it is actually causing his sugar levels to rise, and it actually causes them to rise a lot. And hyperglycemia, which is the sugar levels that are very high, can actually cause convulsions, which may be confused with fits. Like I always say, the results will prove the accuracy of our diagnosis. After the break, we will answer your emails.
Health Haven is a clinic that is in its own league. They stand out in their ability to detect illnesses which have defied the best practitioners in the field of health. They also offer treatment programs that yield phenomenal results. Because of the confidence they have in their healing gift and abilities, they have decided to do the unthinkable. They randomly select one ill person once a month from the entries of their competition and diagnose and treat the winner free of charge to the value of 20,000 Rand. Note that the person selected is unknown to them. They do not know his or her condition. They only get to see the winners for the first time when they go to film them. If you think Mr Stofile is a serious case that is impossible to treat, wait until you see the second and third winners. What gives Health Haven such guts? How do you restore the health of people like these, where doctors have thrown in the towel, unless you know your story?
Welcome back. We are now getting to the session where we answer the questions that you've sent to us via the emails. I will keep on saying that we really appreciate these questions because they give us a chance to cover other aspects of health which are not necessarily covered by the theme of that particular show. We have invited again consultants from Health Haven. I've got Linda Hani and May Louise Ambral. Hello, ladies. Can I have your question, please?
I have a problem with my lower back. I've done some treatments, physiotherapy, acupuncture and rhizotomy, but I'm still in pain. I've changed my bed and pillows, but I'm not getting any better. What could be the cause?
Okay. Lower back pain. There are many causes for lower back pain. You may be suffering from systemic sclerosis, which is an autoimmune disorder that affects the connective tissue, and it may be located in your lumbar spine. You may be suffering from multiple sclerosis, which is also another autoimmune disorder, which attacks the insulating cover of the nerve cells of the spinal cord and the central nervous system. You may be suffering from spinal stenosis. I mean, the list can go on and on, but the one that I've noted to be non-responsive, because you must understand, like I say, that the list is endless. You find that there are some that respond, like if, for instance, it's just spondylitis, which is the inflamed spondylosis. So you will find that if it is multiple sclerosis, because this is what I've found in most cases of people that we've treated, when it's multiple sclerosis, you will take whatever. It just will not abate, because up until you fix or you repair the insulating cover of your spinal cord that is covering the nerve cells, you have not touched the problem area. It's actually the topic that we're talking about today in this show of Lulama, that he's got multiple sclerosis. But in his case, like I've said, multiple sclerosis will present with a large variety of symptoms, some which you may not link at all to the central nervous system or the spinal cord. So like even with the loin pain, So you'll find it's purely because of multiple sclerosis. And the problem with multiple sclerosis or autoimmune disorders, it's very difficult to detect them, because you cannot use an X-ray to detect multiple sclerosis, because it's not a bone or a structural thing. It's a tissue thing. It's at a tissue level. It's at a cellular level. So it's very difficult to detect it. So my advice again would be, if you can, you must just come and see us so that we can scan and see what is causing that in your case, because there may be a variety of causes. So that's the answer that I can give to you. Okay, Linda?
My dad was diagnosed with a stroke. His left hand and arm are shaking terrible. Can you help him regain use of his left arm and hand? He is also diabetic and has blood pressure problems. Doctors told him they can't do anything for him, that he should just control his sugar and blood pressure.
Okay. Let me say the same. It will this is gonna sound like a cliche, you know, because I keep on taking us back to the same thing, that up until you know what is the correct diagnosis, you can never be able to treat. And you can never base the diagnosis on the symptoms. For instance, if he's got because I'm just thinking that maybe he's got tremors like this, he's shaking like this. The possibility may be that he's got Parkinson's disease, or you may find that it's actually emanating from the stroke, and end up causing him to have such traumas. We've treated people where it's not just it's those tremors, but with others you find that it gets worse when they're holding a cup or something. Others, they're just having those tremors on an ongoing basis. Some you may find it's the head, some it's the facial spasms. They keep on twitching and doing all those sorts of things. Now, like I've said, there are many causes for those type of problems, because once a problem interferes with the central nervous system, which is your brain, and it messes up maybe your neurotransmitters and your sensory nerves and all that, you may find that it has got various causes. So like I say, even in this case, we have assisted quite a number of people with various ones. I mean, I remember the worst case that I can remember was someone who could not sit still. It was not just the hand it was just the whole body, where the lower limbs, the upper limbs, the head, everything was just shaking. And in some cases you might find it might not even be a condition, because I remember one case where it was just a serious magnesium deficiency. And when we improved the magnesium intake, in fact, when we suggested or recommended the magnesium intake, it was shocking that caused a huge and a remarkable improvement. So going back to the cliche again, the best is for you to come and visit, or for your dad to come and visit our clinic, so that we can see what is causing him to have such tremors in his case, and then we'll be able to give him the appropriate treatment that is actually going to assist that. That is fixable. That is, I mean, I guarantee you that is actually fixable. You just need to find out what is causing it. Okay.
My husband has a chest pain and we have been to cardiologists. However, the cause of the pain could not be detected. He was given pain medication, but still the pain persists. At times it's mild, but sometimes severe. What could be causing these chest pains?
The common thing that I know to be causing chest pains, which is easily detected, is angina, angina pectoris, which is a disorder or a condition that causes the blood flow not to be consistent. But it's easy to detect angina because the cardiologist, if the cardiologist has actually done some tests, angina is actually quite easy to pick up. But one thing that I know, which conventional medicine has failed on a number of cases that I've treated to detect, but which causes chest pains, is a condition called Takayasu arteritis. It's actually the inflammation of the aorta. Aorta is that large vessel that carries blood from the heart to the organs. Now, Takayasu arteritis is an autoimmune disorder, and it causes the inflammation of the aorta. So when the person, that is why, in fact, I think I'm almost certain it should be that. Why I'm saying that? Because she says sometimes the pain is not so bad, but sometimes it's severe. Now, what causes those fluctuations in the pain is flare-ups. Because remember, when you've got Takayasu arteritis, it actually causes the inflammation in the aorta. So depending on what triggers the inflammation, you will actually have flare-ups. And when you have flare-ups, that's when you are experiencing those serious inflammation episodes. And then when you feel it's not so bad, then whatever you may have taken, or maybe the body has tried and deal with the situation by itself, then you find it that's why you find, I mean, then it gets a little bit better. That's why you find that the pain is not consistent. It is severe consistently. It fluctuates because of the flare-ups. So my gut feel is that person should be suffering from that condition, Takayasu arteritis, which is an autoimmune disorder that causes inflammation of the aorta. Coming to that one again, we are in a position to diagnose and treat. I've treated quite a few people with Takayasu arteritis, and I'm just thinking of one particular client of mine who had that very same problem. And the reason that made him to come to us was because his colleague, who had a serious cardiac problem, a heart problem, and was due for operation in Grooteskier, that operation was actually cancelled because we managed to turn around the condition of that heart. So he then gained confidence and ended up coming himself because he had this persistent chest pain. And I actually diagnosed that Takayasu arteritis. So I suspect that is what this person is suffering from. But like I've said, we need to test you and see if it is really that or it is something else. Okay, next one.
I am a 33-year-old female. I have a problem with fatigue, lack of concentration. I'm also overweight as well as resistance to shedding weight despite food intake restriction. Why could this be?
Okay. This is something that's bothering quite a few people, particularly the ladies. What I suspect in this case, because remember she's trying to restrict her diet, but she's just not losing weight, and she is having a problem of fatigue, and yeah, okay. Now, what I would think in this case is a thyroid problem. Now, remember, when the thyroid is the gland that you find in the in the throat, and it is responsible for metabolism. That is, it controls the rate at which the body uses energy. When it is underactive, you will really battle to lose weight, and when it's overactive, you find you hardly pick up weight. So I suspect even in this case that it might be a thyroid problem. But then when it is Hashimoto, it is a different case. It's not just a problem of having an inactive thyroid, but it's actually an autoimmune disorder where the immune system is attacking your thyroid and it causes leakage. And your thyroid therefore becomes inactive. And you might find that people with Hashimoto, they tend to have cholesterol and you find that their cholesterol levels don't really respond well to treatment. So I suspect that even in this case, she may be having the underactive thyroid, and that is why you will find you get very tired. No matter how hard you try to diet, you will feel you will still maintain a heavy weight. So I suspect that in this case it's Hashimoto. But again here, conventional medicine battles to detect illnesses that are of this kind, particularly autoimmune disorders. Maybe you've been to doctors, but they cannot pick up what is wrong. But if you come to us, we'll be able to tell you for sure if it is a Hashimoto or if it is something else. Okay.
I have a skin infection that I've got from a dirty swimming pool. The doctor gave me an antibacterial wash and a bar soap for scabies, but nothing is working. I even tried putting aloe vera on, but it comes back again. Can you please help me?
The skin infection, well, I wouldn't know what type of eruptions, skin eruptions she actually experiences. If she gets blisters that are open, if she's got pus on those blisters, or it would be interesting to find out the nature of the skin eruption that infection that she's talking about. But if it is an infection from the dirty swimming pool, I'm surprised that that she's not responding to the treatment that is antibacterial treatment or whatever kind of treatment they've given her. But my suspicion, therefore, that if she's not responding to antibacterial, antifungal, or whatever type of treatment they've put, my suspicion is that it's an internal problem. And what I suspect as an internal problem is a condition called polyarteritis nodosa. Polyarteritis nodosa. That is an autoimmune disorder which causes the inflammation of the arteries. Now, remember I just spoke about Takayasu arteritis in that person with chest pain. That's the inflammation of the aorta, which is a larger vessel. But now PEN, which is polyarteritis nodosa, causes the inflammation of medium and smaller vessels. And it tends to affect organs like bladder, like small intestines, and even skin is very susceptible to arteritis, because remember, smaller vessels and medium-sized vessels, they service the skin as well. It falls under those organs that are serviced by that category of vessels. So, and if you've got that condition, therefore, you will never be able to fix it by treating the skin, the epidermis, the skin on the outside. You need to treat the arteries in order to fix that skin, because the inflammation is occurring in the arteries, but arteries that are servicing the skin. But like I've always said, you would need to come to us, because we'll be able to tell you if it is PEN or if it is something else. Again, and like I've said, it's usually difficult for conventional to pick up autoimmune disorders. Okay, is that it? Okay, that's the lot of the questions that we're gonna answer today. And thank you for sending these questions. And thank you for listening. It's really our pleasure to get into these discussions with you. And goodbye.
Health Haven is a clinic that is in its own league. They stand out in their ability to detect illnesses which have defied the best practitioners in the field of health. They also offer treatment programs that yield phenomenal results. Because of the confidence they have in their healing gift and abilities, they have decided to do the unthinkable. They randomly select one ill person once a month from the entries of their competition and diagnose and treat the winner free of charge to the value of 20,000 Rand. Note that the person selected is unknown to them. They do not know his or her condition. They only get to see the winners for the first time when they go to film them. If you think Mr Stofile is a serious case that is impossible to treat, wait until you see the second and third winners. What gives Health Haven such guts? How do you restore the health of people like these, where doctors have thrown in the towel, unless you know your story?
There are many people who have asked if we are medical aid covered. And I feel I just want to close off this show by making a comment on that. We are not medical aid covered. We would love to be. But we all the natural practitioners in South Africa are not yet given a legal status. And therefore, they are not medical aid covered. In America, I know they're quite far in that. All the practitioners that are practicing alternative medicine are licensed and are medical aid covered. But in South Africa, even though we are a first and third world country, you would have thought that we would lead in such milestones, but that is not the case. And I sometimes feel really very bad when a person has tried everything, has been to hospitals, they don't know what's wrong, and they come to us, we can pick up what's wrong, but you find they don't have the money to buy the medication. And we are still working on getting the attention and maybe even the cooperation of the Department of Health so that we can alleviate the level of suffering that people go through just because they cannot afford to buy the medication. But up until then, unfortunately, we can only deal with cash. But if you've got some ideas or what you can suggest as to how best we can deal with this, we would really welcome that. Okay, we would really welcome that. In the meantime, keep working on the diet, because even if you have not started with the treatment, just by changing the diet, you might be surprised at how much improvement you can actually have. Thank you very much. Keep well, keep breathing, and keep laughing, and goodbye.